In this video, we listen to Dr Boon Lim, consultant cardiologist, talk through the steps to complete an active stand test and a NASA lean test. We also talk through the MALMO POT symptom score. Completing the active stand test or the NASA lean test and the MALMO score will help to support medical appointments.
Today we're going to talk about how to perform an active stand test and also a passive stand test, also known as a NASA lean test. For this test, you will need a few ingredients. One is a blood pressure machine, which ideally is an upper arm cuff blood pressure machine. Secondly, a pen and paper, ideally a printout of the sheet that has the columns and rows for you to record 4 things. 1, the systolic or high blood pressure. 2, the diastolic or low blood pressure. 3, the pulse rate. And 4, any notes about how the patient or you might be feeling as you transition from lying to standing for several minutes during these active stand tests. So we have Eleonora from the Imperial Syncope Unit. She's a specialist nurse to demonstrate this. And we are going to be ready to go very shortly. Sorry, the 4th ingredient actually ideally is a person to help you do the test, who can ask you with every blood pressure measurement how you're feeling and writing that on the sheet of paper so that you have ideally a minute by minute account of how you are feeling throughout the 7 to 10 minutes of the stand testing. In the first part of the active or passive stand, we look at getting yourself or the patient to lie down. So Ellie, why don't you come and lie down on a flat sofa or a bed, and in this case this is our tilt bed. What I'm going to do is I'm going to start to measure her blood pressure while she's lying down. So we fit the cuff on like that in the upper arm. We fit it nice and tight, and with Ellie breathing slowly without fidgeting her legs and without saying anything, I'm going to take the first recording, and this is something you can do at home. So we're going to take a series of recordings here. And as the recordings come up and they are giving the final reading on the monitor, and here there are 3 numbers, the systolic, diastolic, and pulse, you're going to write that down and ask your subject, Ellie, are you feeling anything now? Any symptoms?
No, not at all.
Not at all. So I'm going to say no symptoms on my notes column, and I'm going to write this blood pressure that is going to come up soon. And I'm going to do this between 3 and 5 times repeatedly to get an idea of her base level heart rate, blood pressure, and symptom profile. And the reason we take multiple readings, and in this case, this is now 131/76, pulse rate 74. The reason I take 3 readings or 5 readings in the lying position is because I want her blood pressure to stabilize. So when you've taken 5 readings with the patient lying flat on bed, and so for example in Ellie's case we've done 5 readings and we average around 122/70 with a heart rate of 70, we're going to ask you to stand up fairly quickly. So Ellie, why don't you stand up now? And we're going to keep a handle on this blood pressure machine. Ellie's standing, and you can see the important thing about this active stand test is that Ellie's legs should be shoulder width apart, hands by her side, and she should not, and you should not be fidgeting. So you should not be moving your toes up and down or swaying from side to side or tensing your muscles or crossing your legs, because all these are maneuvers to try and activate the muscles. What we then do is we start a blood pressure recording and we ask Ellie, how are you feeling?
I had a little bit of a head rush.
Okay, so Ellie's had a head rush. We don't want Ellie to speak too much to us, so the conversation we try and keep to a minimum, apart from asking about specific symptoms. We wait for the first reading, and then we record this blood pressure reading on our sheet of paper in the standing minute 1 section with systolic, diastolic, pulse, and the notes about having a slight head rush on standing. And Ellie's initial blood pressure is 130/97 on standing with a heart rate that has gone up from 70 to 91 beats per minute. You see, I'm just going to do it again. So I've written these values down and I'm going to go with minute 2. So it's quite quick. The blood pressure machine takes about 30 to 45 seconds to record a value. and I keep going for about 10 minutes, repeating the process. Ellie, how are you feeling now?
Much better.
Much better. So this is the second reading. I'm going to write in the notes symptom section, feeling much better. No further woozy or head rush feeling. And I'm going to record this, and we go again and again till we get 10 recordings or 10 minutes.
To recap, the active stand test starts in a lying down position. You need to take 3 to 5 blood pressure readings whilst lying down and record these on the sheet. This helps your healthcare professionals see what your base level readings are and also allows your blood pressure to stabilise. Once you have these readings, stand up carefully and continue to take blood pressure readings every minute, recording them on the sheet along with any symptoms you may be feeling. Remember, you will need to press the button to inflate the cuff again after each reading. If you cannot print the sheet, we suggest writing the information out yourself in the same format so you can take it to your medical appointment or send in advance if requested. Take your time to ensure you know how to use the blood pressure machine. Ensure the cuff is placed on the upper arm, making sure the arrow on the cuff is in the correct place. We appreciate there is lots of information to take in. Some other useful tips are: stay as relaxed as possible, keep your legs uncrossed, keep both feet on the floor shoulder width apart, try to stay as still as possible when standing, keep conversation to a minimum. Where possible, it is better to have someone help you do these tests. Let this person press the button and record the readings so that you can stay still and in the same position. Occasionally, some people faint during the stand test, so please ensure you have made a clear and safe area around you just in case. Dr Lim will now talk us through an alternative to the active stand test, which is called the NASA Lean test. This can be used as an alternative if you feel at risk of falling or fainting when you stand.
So a variation of the active stand test that you've just seen is called the passive stand test, where you're using the wall, in this instance this grey door, to rest your shoulder and your back and maybe your head against the wall, which is also known as the NASA Lean test. And the way you stand here is with your feet shoulder width apart and probably 6 inches or so from the edge of the wall. So you're leaning slightly backwards into this flat surface and resting your shoulder. And what we do here is that Ellie will transition from a lying to a standing directly against the wall. So pretend this is the first minute of her standing up. I'm going to ask Ellie, how do you feel?
I feel
She feels okay, and we're going to wait for that blood pressure reading to come in with the systolic, diastolic pulse and symptoms. She said she felt okay. I'm going to write okay on my notes. And as we populate this sheet over a 10-minute or 10 recording period, we'll get a flavor of what her pulse and her blood pressure does. So here she's 119/93, pulse 90, feeling okay. I'm going to write that down, and then we go again with her standing again straight without fidgeting or moving her legs. And this completion of the 10 readings or 10 minutes would complete the passive stand test or the passive NASA Lean test. So if as a patient you feel vulnerable when you stand up and you feel very close to fainting, then it might be better for you to do a passive stand test or a NASA Lean test and maybe put pillows on either side just in case you lose consciousness. Now, you don't have to complete all 10 readings if you feel extremely unwell, dizzy, because if you register your symptoms and a pulse and your blood pressures, but you continue to feel unwell, please don't keep standing till you pass out. Stop the stand, get down to the floor and be safe. So try not to lose consciousness. The idea of this active stand is to give the doctors a flavor of what your blood pressure, pulse and symptoms are with standing as long as you can tolerate standing. It's not to make you pass out. And so if you feel at risk of passing out, abort the active stand. So Ellie, if you feel unwell at any time, you should just come down to the floor and I will abort the test and support you down so that it's done in a safe environment.
As Dr Lim explained, you may wish to choose the NASA Lean test rather than the active stand test if you feel vulnerable or at risk of falling or fainting. Be safe and choose what is right for you. You do not need to continue with all 10 readings if you start to feel very unwell or at risk of fainting. Please remember that whilst not shown in the video, the first 3 to 5 blood pressure measurements for the NASA lean test must be taken whilst lying down. Please refer to all of the other advice in the active stand summary, as this applies to the NASA lean test as well. We will now listen to Dr Lim explain why it is helpful to complete this test ahead of your appointments and how they can also be beneficial at a later stage for monitoring progress.
So some considerations when you're about to undertake an active or a passive test at home would be as follows. If you've never done this before, it's very likely that these results will be very helpful for your first consultation if you've not seen any of the medical professionals or a cardiologist or your GP. Taking this bit of information with you can be useful for them to understand what happens when you stand up, and with your blood pressure and heart rate and symptom changes recorded on this sheet, it can be very useful for us to make a decision about your diagnosis and management plan. What other things you might need to do before undertaking this stand? I think for the first time you're doing it, you should really try and be nil by mouth without any consumption of caffeine or alcohol before you do this test. You should also try and do it in a quiet, non-stimulating environment. So for example, not a very involved or intense conversation before you have the stand test. Things should be nice and calm. Thirdly, if you can, try not to do it in a very cold environment, which can artificially elevate your blood pressure. You want to simulate the conditions in which you can maximally recreate your symptoms. This is how you might do an active stand for the first time to show to your healthcare professional in order to get an initial diagnosis. Now, there is a second way to use the active stand, and this would be to try and assess your response to the treatments that could be initiated by your healthcare professional. For example, most of you will be asked to drink more fluids, have salt, wear compression leggings or abdominal binders, and you might be able to do a repeat active stand, for example, half an hour after you've taken an isotonic electrolyte drink, wearing compressions and abdominal binders. And it's good for you to appreciate the changes in your measurements and symptoms, repeating the active stand to recognize the impact of this conservative strategies on your symptoms. Equally, if you are prescribed a drug, common drugs could include midodrine, which improves your blood pressure, or ivabradine, which lowers your heart rate, or propranolol, a beta blocker, which can also lower your heart rate. We can look at the impact of these drugs on your active stand results. So for example, half an hour after taking any of these drugs, you could repeat your active stand and see if you notice a change in your symptoms, blood pressure and pulse rate, for you to understand that these drugs are either making a big difference or making a little difference or making no difference in your symptoms.
We will now talk about the MALMO POTS score. This is a validated tool for assessing POTS symptom severity. This questionnaire asks patients to score on a scale of 1 to 10 by how affected you are by the symptoms. To support medical appointments, we suggest that you complete this survey monthly and take these results to your appointments to help your healthcare professionals get a clearer understanding. For further information, please visit www.potsuk.org.